Hi, my name is Dr. Vilash Reddy. I'm a child and adult psychiatrist who has a good amount of experience in addiction, though I'm not an addiction psychiatrist. My practice is set up to be very holistic, as I know that the psychiatric industry has become very pill-pushing. And honestly, I read some statistics which were very shocking, but the average time a psychiatrist or physician spends with a patient is about 17 minutes on average. And I don't like taking shortcuts because I feel like patients are put on the wrong medicines for the wrong diagnoses and don't spend enough time really understanding what they're going through. And I'm a big advocate for therapy. In fact, I think everyone needs therapy because we all have blind spots, right? If we were perfect and born perfect and never had any problems, then you wouldn't even need to see a mental health provider. But I believe that I focus on being very evidence-based in terms of what I prescribe, because a lot of prescribers prescribe mood stabilizers and antipsychotics that are unwarranted based on an underlying diagnosis. Like I've often seen people with depression getting Seroquel, other medicines, which can be helpful, but there are a lot of side effects to a lot of these medicines. And many people are frustrated with the way that the system is set up because they're put on so many medicines that cause so many side effects when there are much simpler options out there, which is why I started to learn and implement alternative remedies, which can be less potent, but everything is all about degrees, right? So here's an example, like Ambien or Lunesta are sleep aids, but they literally cause you sedation to fall asleep, and that actually disrupts your REM sleep pattern. So it's important to be mindful about what you do take, but I think that one of the most important parts is also integrating a therapy into your practice. And we could discuss the type. There are skills-based therapies like CBT and DBT, and more extensive ones like psychodynamic psychotherapy. And to be honest, I prefer psychodynamic psychotherapy and was trained for many years for it. And the reason why I like it is it helps explain to get to the root of where your cognitive distortions come from. In CBT, they explain to you the 10 different types of cognitive distortions, but it's hard to identify why you think black or white or all or none or various terms used if you can't understand the root problem and where it originated in your life. Was it trauma? Was it, parental neglect? Was it parental style? So I tend to focus on kind of a bottom-up approach. So I like getting to know your childhood and what you were like and what events happened to create a really succinct formulation so that we may decide, we don't want to do medicines. We just want to do therapy and some alternatives for some symptom management. And I'm okay with that. Like I said, I tailor my care for you because you are the one suffering with whatever condition you have. And to be honest, I'm very open to feedback. If you're not responding to a medicine, you don't feel like it's helping or therapy's not helping, we could easily change it up, because sometimes I may think one style's good for you. Like, I may choose a therapy that I think would be beneficial, but over the course of time, we may realize collaboratively, I like to collaborate a lot with my patients. And that's part of why I've been able to be successful and have received recognition through various organizations for that my patients do like working with me, because I really try to stay humble, because I've lost a good number of really loving people in my life based on mental illness. So I'm very passionate about what I do, and you'll see the difference from day one, because I am very transparent about the amount of time I take, and I give you my suggestions. And again, we may come to a consensus of meeting halfway, and that's totally fine. I will never push my agenda onto any patient. I want them to feel comfortable working with me, because that is the most important factor that I have researched about compliance, is the patient not feeling heard by their provider. In fact, there have been studies where a patient was given a placebo, but they felt very understood by their doctor, and they showed more improvement than a detached doctor prescribing real medicine. So there's something to be said about human connection that helps the healing process. So I hope you give me an opportunity to help you feel better, because I know mental health can be challenging even on a minor, moderate, or severe level. And if you ever feel like you need to reach out, I'm always available. And I have set up my practice in a way to always be very, very cautious about your safety, because that's the most important thing to me. So I hope you have a great day, and I hope you decide to join One Life Psychiatry. I see patients from 3 through 80 years old. Again, I see a very broad spectrum of patients, because I've had a lot of experience dealing with that. And if I don't really feel like I'm the best fit, I will tell you that, because I don't want to. I want to be transparent, and I want to be honest with my patients. If there's a very complex case. But I do provide a lot of those details on my website about what cases I don't feel comfortable with because of the complexity and a lot more hands-on intervention that would be required. I hope you have a great night, and I look forward to seeing you.